Vascular Surgery Department. I am here to talk about the drug elution agents Unveiled, Paclitaxel versus Sirolimus. It's a very difficult topic for a vascular surgeon as it mainly deals with pharmacodynamics as well as pharmacology. So I have to go back to the basics. So drug-eluting stents has drastically revolutionized the outcomes in coronary and peripheral arterial disease by reducing restenosis and enhancing long-term vessel patency. So the aim of this talk I will be concentrating more on mechanism of action, pharmacological action, as well as the clinical efficacy, as well as the safety and long-term patient's outcome. So, though for vascular surgeon, it's crucial to understand the basics of these drugs. So, initially, how it evolved, as Sir had described about the history and other things, the complication in various procedures. Initially, a balloon angioplasty, where the acute vessel closure and recoil percentage was at least 15 percentage. So, to reduce that, they have invented so many other things like bare metal stent. Even that it had its complication of around 10%, from which the first generation, second generation and third generation, and recently bioabsorbable vascular scaffolds are invented. But all these have a late complication of around 5%. Still vascular surgeons or the biomechanics, they are searching for the holy grail. So when we see the bare metal stent, there is this bare metal stent doesn't cause any modulation of the intima, and it leads to a progressive and aggressive intimal hyperplasia leading to late stage immitent hyperplasia as well as late stage failures due to neointimal hyperplasia. So objective is to form a new coated stents, prevent neointimal hyperplasia and avoid late stage stent failure. And all my references are taken from this bioactive material. There is one journal called Bioactive Materials, and it is to be published by February 2025. So the drug eluting stent component is stud designs polymer eluded drug as well as delivery system. But later on the speakers will be concentrating on this topic. Stud designs itself may cause a thrombosis, or it may induce a rheological effect which may induce a restenosis. The polymer used also influences as well as the eluded drug and delivery system. Each component may complicate the procedure. So this evolution of bare metal stent to recent biodegradable stents. So my topic is mainly on Sirolimus and Paclitaxel. So first generation drug is of Sirolimus and Paclitaxel, from which till the third generation Sirolimus is the standard. It is in use. But the stent platform, which was initially steel, had evolved to cobalt chromium, and the stent stud thickness, which was initially thicker than the third generation, 0.14 millimeter, had evolved to 0.74 millimeter, and various manufacturers are there. History wise, Sir had dealt on the balloons and stents, but history of Paclitaxel, it's produced from endophytic fungus Taxomyces andreanae obtained from Pacific yew tree. So this Pacific yew tree has the limitation of production of Paclitaxel, because the Pacific yew tree is slow growth trees. So that made large scale production difficult. So they evolved to a semi-synthetic form. The Paclitaxel lipophilic nature is very important for the prolonged action of the drug. So that requires the oil base, and later formulated with albumin nanoparticles to reduce the toxicity. So mechanism of action, this Paclitaxel acts in the microtubules, it stabilizes microtubules. So this stabilization of microtubules halts the progression of G2 to M phase arresting cell division at mitotic phase. So this is the biomechanics, what it is actually taking place. When you see the paclitaxel, it acts in the predominantly during cell division in mitosis phase of the cell cycle through centromere impairment, induction of abnormal spindles and suppression of spindle microtubule dynamics. Whereas sirolimus acts in P27 as well as mTOR. mTOR is the mammalian target of rapamycin. So this specifically acts in the different pathway. It inhibits from synthetic phase to G phase. So action in vessel wall, how it differs from paclitaxel and sirolimus. Paclitaxel prevents excessive proliferation and migration of vascular smooth muscle component. This vascular smooth muscle component is the main culprit in producing the neointimal hyperplasia. So inhibiting vascular smooth muscle cell is the main target of these both drugs. So the paclitaxel acts specifically in vascular smooth muscle cells as well as the cytotoxic effect on vascular smooth muscle. There is one mechanism called mitotic slippage where it briefly arrests the G1 phase of cell cycle. This effect curbs excessive vascular smooth muscle proliferation and migration. The other mechanism of paclitaxel is senescence, cellular senescence, that is the premature aging of the cell. So this also inhibits the vascular smooth muscle as well as it inhibits glycoprotein VI signaling. This reduces platelet aggregation, thrombus formation, minimizing clotting risk post angioplasty procedures. So apart from the paclitaxel, now it's the sirolimus drug eluting stents. All these are all molecular basis, which is very difficult for me to understand, but I am here to deliver a lecture, so I prepared this with lot of difficulty. Yes, sir. So inhibition of mammalian target of rapamycin pathway. This sirolimus inhibit mTOR as well as binding to FKBP12 forms a complex that blocks mTORC1 disrupting cell growth signals. So the cell cycle arrest occurs at G1 and S phase that inhibits vascular smooth muscle as well as the endothelial cells. Endothelial cells safeguards the restenosis process as well as rethrombosis process. But sirolimus destroys both the protective layer of endothelium as well as the vascular smooth muscles. Inhibition of mTORC2 potentially affects endothelial cell survival and cytoskeletal integrity. This cytoskeletal integrity is very essential to maintain the integrity of the vessel. So this inhibits both cytoskeletal mechanism as well as the vascular smooth muscles. So clinical efficacy. When we see the clinical efficacy, due to this biomechanics, the cytotoxic effect of paclitaxel is far ahead comparing to sirolimus, whereas sirolimus is cytostatic, and the high lipophilicity of paclitaxel, it has a prolonged tissue retention and prolonged tissue action, whereas the sirolimus low lipophilicity requires. So this has to be encapsulated within a nano carrier particles. So efficacy of paclitaxel, it's a smaller luminal loss is occurring in paclitaxel as well as more frequent luminal enlargement. So paclitaxel has better effect than sirolimus, but still we prefer sirolimus because of the complication and the adverse effects of paclitaxel. The paclitaxel has more anti-cancer effects on the person itself. So safety wise, potential arterial downstream tissue injury due to narrower therapeutic range and theoretical concern for distal embolization and systemic toxicity, whereas sirolimus wider safety therapeutic range. But all this experimentation was done mostly in coronary arterial diseases, less experimentation on peripheral arterial diseases till date. So paclitaxel versus sirolimus, the comparative efficacy, paclitaxel show more potent anti-proliferative effect than sirolimus but has higher risk of adverse effect, that is distal vessel embolization. This mechanism only while I am going through this complication of distal vessel embolization in stent is even in drug eluting stent I came to know. And there is also intimal hemorrhage, persistent fibrin, increased inflammation, whereas the sirolimus, though effective, may lead to distal embolization, particularly in higher doses. So dosage also should be properly monitored while designing these drugs. Cell apoptosis, paclitaxel induces more cell apoptosis, inhibiting vascular smooth muscle proliferation and migration. Sirolimus is more effective against endothelial progenitor cells. This endothelial progenitor cell is a protective layer. So the other, as I have already mentioned, the lipophilicity and drug retention, paclitaxel have better uptake and retention at target sites comparing to sirolimus. And distribution, sirolimus is evenly distributed across the artery, while paclitaxel show uneven distribution, potentially causing localized damage to the vessel wall. Hypoxic environment and atherosclerosis. Sirolimus inhibit hypoxic cell proliferation in vitro. It is just in experimental stage. It is not proven in human beings, whereas paclitaxel efficiency is reduced in hypoxic conditions. So when we see the gene expression, paclitaxel upregulated genes related to inflammation and apoptosis, while sirolimus did not have these effects. So paclitaxel have narrower therapeutic window and may cause more harmful vascular effects. Comparative study, when we see the paclitaxel versus sirolimus, no significant difference in segmental luminal loss or MACE between these two drugs. Similar 1 year target lesion failure between restored paclitaxel and sirolimus. All these differences and experimentations are from first generation drug eluting system, not on the third generation system, where sirolimus alone is used, paclitaxel is discontinued. Angiographic outcomes, paclitaxel shows significant less late luminal loss and higher rate of luminal enlargement comparing to sirolimus, whereas in meta-analysis, though paclitaxel has adverse effect, there is no much difference between 1 year, there is no lesional failure between paclitaxel and sirolimus. And meta-analysis, paclitaxel use is associated with higher rate of late luminal enlargement, suggesting better vessel remodeling, which may be linked to cytotoxic effect of paclitaxel. So safety, when we consider safety, paclitaxel delivered via semi-compliant balloon. This initially I was discussing about the stent, now the drug eluting balloons where we routinely use for peripheral arterial diseases. So this is about the balloon which delivers the paclitaxel, is encapsulated in hydrophilic excipients to enhance distribution within the vessel wall and prolonged therapeutic tissue levels. It may be extending up to 2 months, whereas prolonged retention can increase the risk of adverse effect like intimal hemorrhage, fibrin deposition and medial necrosis. Preclinical and animal study findings, the cytotoxic effect on vessel wall with a potential embolic complication from drug and excipient particles causing downstream vessel necrosis as well as embolization. Apart from embolization, the distal vessel getting necrosed, leading to inflammatory reaction, and various studies like IMPACT deep trial and Constantinos et al., all these studies shows various results, but the concluding part is initial studies raised safety concern, but recent research suggests paclitaxel coated devices may be safe with proper usage. Ongoing RCTs are needed to definitely assess the long-term safety and efficacy of paclitaxel in peripheral arterial disease revascularization. So safety profile, paclitaxel eluding stent may cause incomplete healing, increased fibrin deposition and medial cell loss, potentially contributing to long-term complication as late stent thrombosis and persistent inflammation, Sirolimus shown more favorable long-term safety profile with lower rates of stent thrombosis and improved healing. So the newer balloons are dual balloons which has both paclitaxel as well as sirolimus in 1:9 ratio, and they are encapsulated in biodegradable nanoparticles for prolonged drug distribution in vessel wall. So this is the I think the next speakers will be talking on the recent advances. So based on this experimentation, the inhibition of smooth muscle cell, promotion of endothelial cells is the main results we have found till date. The other things like integration function, release plaque, repair lesion environment, all these are still now they are studying these effects. So when we introduce a stent, there is an injured endothelial layer as well as inhibition of smooth muscle cells. The blue and red dots, the bioactive molecules and cell proliferation inhibitors play the major role in any stent, drug-eluting stents. So take home message, as I have already mentioned, paclitaxel acts more like a razor blade, whereas sirolimus is more like a trimmer. Though paclitaxel is very sharp and it can have a better results, the complications are more with paclitaxel. So the recent drugs they use, they prefer sirolimus comparing to paclitaxel. So this bird is native of Mumbai. We fly from Chennai to we explore this area Panavel to take this oriental dwarf kingfisher. Some 6 months back we came to Mumbai. That's the connection of this picture with this place. Thank you.